We are in the occupational therapy room. This is called a sensory table. And today there's rice inside of it. You can fill this bin up with water, sand,
Corn.
snow. Yeah, so it's great. And we've got some objects hidden in here, a couple of spoons, that the kids can use to, put the rice in. And this is very good for, for problem solving, picking up a spoon, holding
We do a lot
onto
of
it.
midline crossing of the body, bilateral hands working together.
Yeah, one side to the other side,
As
yeah.
simple as just the tactile input, it really helps the kids to focus later on when they're sitting at the table. So having different items in a sensory bin is very useful.
It's called a crawl tunnel, and we've got Carrie going through it right now. This is really good for kids who have a lot of sensory needs. Gives them some nice, closure. If they're overstimulated, they can go, they can work their way through here.
It can be a very
calming and comforting effect on kids.
Not only that, but like a good heavy work activity where they're using their body to crawl through, or even army crawl.
Yeah, I never really had thought about that, because that takes a lot of work to crawl on your hands and knees to get through here. And like Jennifer and I were just talking, I mean, that's a really good skill for like pre-riding, because you're putting pressure on your arms and your hands.
On that proprioception.
Going through the tunnel, so it's good for for pre-riding. Let's see. Oh, and really good motor planning through here, because you got to start at one end and come out through the other. And once in a while, the kids, they get there in the middle. They don't want to get out. So then the OT has to go in and get them. Or no, doesn't this help?
Actually, we have learned that we can just swish it and walk.
Yes,
and it
swish
just flushes them out.
Yeah,
so we never
flushes
get
the
anyone
kids
stuck
out.
in there for very long. They do very much enjoy it. It's one of the more famous activities that we do have. So we work on the tunnel quite a bit.
We've got another item over here. This is called Therapy, and it's pretty. This is pretty brand new, isn't it, Jen?
Yes.
Yeah. This is great for putting your fingers into it, hand strengthening.
Yeah, we definitely use it for the strengthening. Sometimes we actually use the entire bucket and then let them stretch it out. And that way they really are using a lot of hand strength.
I've seen objects hidden in this too, where you use the whole thing.
Better for the fingers and the pincer grasp, being able to find little items. We put erasers or little tiny toys in there. That keeps the kids very occupied. Also with the tactile of it, it's kind of like a safe, easy way to work in a messy media when children are kind of feeling
like they don't
tactily defensive.
Because there are a lot of kids that don't like to touch certain things, so they can really manipulate this and get those the pincer grasp, like your thumb and your forefinger in there, and that helps eventually to work on feeding, buttoning, holding onto a pencil, crayon.
Definitely being able to have the right kind of strength for all the things that you're going to need later on in school.